Hi, this sequence is for daily maintenance and assessment of low back stiffness and sometimes chronic back pain. Lie on your back, feet bent, knees bent, feet flat on the floor, and practice belly breath. Rising and filling the belly on the in-breath. Belly falls towards the ground and the low back on the out-breath. Hands by your hips. Add the pelvic tilts on the in-breath. The tailbone falls to the floor. Out-breath, low back into the floor, tailbone lifts. Back and forth, keep breathing and sensing and moving the pelvis without lifting it off the floor. Does one motion feel better than the other for your low back? You can do this motion just by pressing into the heels on the out breath and releasing on the in breath. Use your imagination, and the next time your low back presses into the ground, that's home plate, and the next time your tailbone goes to the ground, low back lifts. This is second base. Back and forth between home plate on the out breath, second base on the in breath. Return to pelvic neutral, where your low back is not pressed into the floor and is not lifted away from the floor, but there's a nice little arch in your low back. And then we'll lean into the right hip by lifting the left hip. And reverse that, lift the right hip and roll to your left side. Left hip presses into the floor. And back and forth with this movement. If we're using the baseball analogy, the next time your right hip comes down, left hip lifts. This is first base. And the next time your right hip lifts and you're on your left hip down, this is third base, back and forth. Does one direction feel different than the other today? One is not good or bad. Just assess how your low back and pelvis feels. Return to neutral, and then we'll roll around the bases. Roll around the rim of your pelvis like a bowl. Both directions. Using your heels into the floor for power. And back to center. Hands on your knees, elbows straight on the inhalation. Exhale, elbows bend and pull the knees into your chest. Back and forth like a piston. Notice how the low back presses into the floor and comes away just slightly. Continue to massage your low back by moving the knees around in a circle like grinders, and opposite direction. If this feels good, repeat longer and more often. Also, you can separate the thighs and do circles in opposite direction if that feels good. Reverse your circles. What feels better today? Knees glued together or apart? Return your feet to the floor, hip width apart. Lift your right heel to the sky, toes to the nose. Hold on to the back of the thigh and gently push the thigh away from the face, but the hands pull it in. Breathe into the sensation on the back of the leg. If it's challenging for you to straighten behind the knee, Try a few knee flexes, extending the heel to the sky. Repeat this often. Turn the right hip out, right knee out, and figure 4. Left knee into the chest. Use your arms and hands to support and intensify the stretch. Breathe into those sensations, softening around the hip. Roll to the left side slightly to feel more sensations. Back to center. Repeat the left side. Hamstring stretch, toes to the nose. Your supporting leg, the right knee can be bent or long on the floor. Some days I use the tie, some days just holding with the hands is enough. Pressing the thigh away from the face, but pulling it in with your hands. And remembering that the hamstring goes behind the knee, add the flexion. Slowing down with the breath. Both feet flat on the floor. This time walk your feet wider than your hips, maybe as wide as the mat, and we'll practice windshield wipers by dropping the right hip towards the left foot. You can use the right hand for just a mild traction so you feel it in here. Repeat on the left side, left knee towards the right foot, using your left hand for a little bit of traction, opening in the front of the thigh. That's what we're going for. You can hang out here, especially if one side feels better or different than the other side, or back and forth like the windshield wipers. Both knees high, feet flat on the floor. Now walk the feet hip width apart again, just like in the beginning. Go back to the pelvic tilts for a few rounds and notice if your low back has changed from 5 minutes of movement. If it feels better, more open, more energized, more free, repeat this sequence often. Maybe once or twice a day. Every morning is a great way to tune in. Thank you so much for practicing with me.